everybody, Deidre here again. So today I want to have a little bit of career talk and why major in public health. So I'll share why I started in public health. So way back when, we won't go into how long ago. I actually, for my undergrad, I majored in health administration. As I got closer to ending my senior year, I thought, well, I want to really make sure that whatever I choose for a career has a broad reaching. I have a lot of options in how I work with people and how I affect people, whether it be a larger population or my community. And so public health it was. And so I have a master's in public health degree. So that's an MPH. So I'm talking today about, why I think, if you're on the fence and what you want to do, I'm here to, share my reasons why I think a public health degree or to major in public health could be beneficial. So why get into public health? Why get your MPH? Well, to put it simply, because we need as many professionals as we can. I think that this last year, 2020, has shown us, especially with COVID-19, has showed us the need for gaining more information and understanding outbreaks, understanding disease, understanding how things move, because we're always going to be faced with new things. So we need people who are going to be out in the field studying the people, studying how things work and move, and also studying the history of those things so that we can better understand how to prevent death, prolong life, and promote health. So let's think about this in terms of COVID-19 and frontline workers. They're literally putting their bodies at risk to help everyone else. And when you think about that clinical setting, in order for them to do their jobs to the best and the fullest of their abilities, the information gathered from public health, or that broad spectrum of health information, is crucial to doing their job. That way, when a patient's being treated and they're literally standing in front of the doctor or the nurse, that clinical professional has the tools that they need, not only to pull from what they need for medical intervention and focusing on the individual, but also looking at this person and thinking about what happens in their community, right? In the places where they live, work, and play, so they can decipher how they are even at risk for certain things, at risk for catching COVID. We understand that COVID not only made people sick, but it really magnified the disparities in healthcare, right? Or the disparities that people experience when it comes to getting better. The other reason to get into public health is the options. There are so many fields that you can go into with public health, whereas I think moving with just healthcare administration, which is what I did in my undergrad, I didn't see that there were so many options. And I'm not saying that there aren't a lot of options. I think in my experience, I have witnessed a lot more options in public health. So I just wanted to share that little tidbit on why major in public health. And I think for right now, the answer is really simple, and it's because you're really needed. We always need those professionals who are going to go out there and be in the field and get that information. One little tidbit to remember is that even folks who are in the clinical field will get MPHs. So there are definitely a lot of doctors who are MD/MPH, because I think they recognize that need to merge that prevention and preventative care with the intervention part of the medical care. So hopefully this was helpful for some of you who are thinking about going into public health and what you can do with it. We'll definitely go in deeper next time about some of those different careers. So in the meantime, thanks for stopping by, and we'll see you next time. And as always, like, share, and subscribe.